This is Sabrina Jamil, ready to do my head-to-toe assessment for physical assessment, and just going to scan the room to show that there's nothing abnormal or coding in here. Okay. Hi, my name is Sabrina Jamil. I'm going to be doing a head-to-toe assessment on you. I'm just going to wash my hands and close the curtain for privacy. Are you feeling any pain or tenderness today? Are you allergic to anything? Okay, and could you identify your name and date of birth?
Kaylin Gasso, 8/16/96.
Thank you. And could you tell me your name again?
Kaylin Gasso,
And where you are?
West Bloomfield,
And what the year is?
2016.
Great. Patient's stated level of consciousness is an ANO times 3, and you're sitting upright. Your speech is normal pace, tone, no slurring. Mood and affect are appropriate, and overall your nutrition and hygiene seems normal and intact. And we're going to start by inspecting the skull and the hair and head area. So I don't see any bumps or scarring or elevations. I do see a mole, and with that what we do is we do an A, B, C, D, E grading, and the A stands for assessing symmetry, which the mole is symmetrical, and B is for border, which is normal. C is for color, which is also normal, no abnormalities with the color, and D for diameter, the size and shape is okay, and E for elevations, which are absent. The mole is not elevated, so we're in good shape here. The texture of the hair is normal and appropriate. Now we're going to move on to your eyes. Okay? And what I'm going to do here is shine this light in your eye, and we're going to test for perla. And both pupils constrict evenly. The eyes are symmetrical. Conjunctiva is pink and moist and normal. And now I'm going to assess your mouth. So if you could open your mouth for me. Stick out your tongue, please. Uvula is midline and present. Tonsil rating is about a 2. Both uvula and tongue are midline. Mucous membranes are pink, and can you stop for me? Teeth are present, and gums are also moist and pink. And I'm going to have you smile again and puff out your cheeks. And right there I tested cranial nerves 5 and 7, which are both functioning properly. And there's no abnormalities in the skin. Temperature is okay. Good. Color is flush. And I'm going to move on to your neck, where here I'm going to palpate your carotid pulses. Okay, great. And now I'm going to listen with the bell of my stethoscope. I'm holding your breath, which is great. Okay, and could you just lift your head back just a little bit into the side and to the other side? No JVD is present, no vein distension. And I'm going to move on to your upper extremities. Just going to have you hold out your hands. Skin is normal, no scarring or abnormal skin abrasions, except for there is another mole, which looks normal again to me. And again, the grading for this is the A, B, C, D, E grading. A is for asymmetry or symmetry, which here it is symmetrical, and the border is also normal. There's no abnormalities with the color. The diameter and size is appropriate, and there's no elevation, so we're in good tact with the mole there too. And now I'm going to move on to feeling for your radial and brachial pulses. Okay, great. Move on to the brachial pulses. Both are at about a 2. And then I'm going to check for cap refill, which blood returns back to the nails and the hands in less than 3 seconds. And can you squeeze my hands? Upper extremity strength is equal on both sides, and there's no nail clubbing, no hand clubbing. Okay, great. And I'm going to move on to listening to the heart, and what we do here is listen 8 to man, so that's the aortic, pulmonic, herbs, tricuspid, and mitral spots. So, do that with the diaphragm of the stethoscope. Could you sit up for me a little bit? Thank you. Aortic, pulmonic, herbs, tricuspid, and mitral. And at the mitral spot is where I would listen for 1 minute for the apical pulse. And then right now, again, I'm going to go back up to the heart with listening to with the bell of my stethoscope. So it's going to go mitral, tricuspid, herbs, pulmonic, and aortic. And now I'm going to move on to assessing the lungs, where I'm going to listen to 10 spots on the front, 10 spots on the back, and 2 sides on each side laterally. And could you take a deep breath each time, please? Okay, now I'm going to move on to your back. Deep breaths, please. Okay, and 2 sides. Okay, great. And could you please stand for me and assess the thoracic region? Here I'm going to press your costovertebral angle, which please note if you have any pain.
No.
Okay, great. And then could you bend over for me? Spine is midline. There's no abnormal curvature of the spine. Everything looks normal here. And the anterior posterior diameter is 2 to 1, which is also normal. Let me take a seat. And now I'm going to assess the abdomen, which here we do IAPPA. I is for inspection, A is for auscultation, P is for percussion, and P is for palpation. So, first inspecting the abdomen, there's no scarring, no tissue, no abnormalities, no lesions, nothing abnormal with the skin of the abdomen. And next I'm going to auscultate, listening for bowel sounds. Bowel sounds are present, and where I listened there was in 4 quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. In the right upper quadrant is the liver, and the right lower quadrant is the appendix. And when we go to the left upper quadrant, we have the stomach, and the left lower quadrant, we have the left ovary. So after auscultating, I am going to percuss the abdomen, where my patient, please note any pain or tenderness, and listening for dull sounds and timpani sounds, and sounds should be normal there. Any pain or tenderness? All right, and continue to tell me if you have any pain or tenderness while I palpate. Good?
Mm-hmm.
All right. And now I'm going to move on to the lower extremities. Okay. And here, my patient's skin is normal temperatures, normal skin is a normal color, no scarring or abnormalities with the skin. And then here I'm going to listen to 3 pulses: the popliteal pulse, the dorsalis fedalis pulse, and the tibial pulse. So. Okay, that was the popliteal. Here is the dorsalis pedalis. And then assessing for edema, which is not present in my patient. And now I'm going to perform the Babinski test. Patient reacted normally, toes curled at the tickle, the touch. And now I'm going to perform the Romberg test, where I'm going to have my patient stand up. Please close your eyes and have your arms to your side. And here I'm making sure that she's not swaying, losing her balance, can't stand still, which she's doing perfectly fine with, so you can open your eyes. And next I'm going to do the get up and go test to assess my patient's gait. So what I'm going to have you do is please walk to this chair, take a seat, and then walk back and take a seat. And as you can see, my patient's gait is steady and balanced. She didn't delay her reaction time in sitting or getting up, and she was mobile and moving just fine and normally. And thank you for letting me do my head-to-toe assessment on you, and that concludes the head-to-toe assessment.